What a patient should look for when choosing a surgeon in general is stuff that most people are pretty familiar with. I mean, you want to have a consultation outside of the hospital in the emergency room, wherever you happen to be interfacing, and really just kind of get a feel for the doctor. How much knowledge does he seem to have? How much experience does he seem to have? And just an overall feel of whether this surgeon's personality fits with what you expect to have in your surgeon. When it pertains specifically to robotic surgery, experience is obviously the key. It is fair game for a patient to ask the surgeon how many of these procedures has he performed. There is a considerable overlap between your traditional laparoscopy and robotic surgery. So I do believe some laparoscopic experience translates into overall experience in camera-guided, remote, if you will, type operations. As I converted my practice over from a laparoscopic practice to more of a robotic practice, the transition is fairly easy. But you still want to know how many of these the surgeon's done. Are you his first patient? Are you his 75th patient? There's obviously some impact there. Obviously, every surgeon has first patients, but my patients were aware that they were the first patient. I did tell them that I had experience with 3,000 gallbladder surgeries done with the traditional laparoscopic approach. I explained to them that now I'm using the robot, and I explained the differences between the two and the similarities between the two. And your surgeon should be open about that, because that is important information when choosing a surgeon.